Now we are going to discuss sutures and anastomoses. First, we will discuss the types of sutures. Sutures are usually of two types, absorbable or non-absorbable. If it is absorbed in the tissues, it is absorbable, and if it remains in the tissues for indefinite period of time, it's non-absorbable. So have a look of classification. Sutures. It is of two types, absorbable and non-absorbable. Absorbable sutures are absorbed in the tissues. Due to enzymatic digestion or phagocytosis. Whereas non-absorbable sutures persist in tissues for indefinite period. After that, it is further divided into natural and synthetic. So have a look of natural absorbable suture. It is of two types. One is catgut and the second is chromic catgut. Similarly, there are synthetic absorbable sutures. And what are those synthetic absorbable sutures? These sutures are polyglycaprone. The other name of polyglycaprone is monocryl. Polydioxanone. Other name of polydioxanone is PDS. Vicryl. What's the other name? It's also known as polyglactin. And Dexan. Dexan is also known as polyglycolic acid. Now how to remember these sutures? Here the mnemonic is PVD. The mnemonic is PVD. So you can see that synthetic absorbable sutures are polyglycaprone, polydioxanone, Vicryl, which is also known as polyglactin, and Dexan. Now see, natural non-absorbable sutures. And the natural non-absorbable sutures are silk and linen. Silk and linen. After that, what are the synthetic non-absorbable sutures? You must be knowing there is proline, also known as polypropylene. Proline, also known as polypropylene, polyester, ethylene, and nylon. Polyester, ethylene, and nylon. How to remember these sutures? There is a simple mnemonic, PEN. So you can see PEN. So this is the classification of absorbable suture and non-absorbable sutures. After that, sutures are further divided into two types, monofilament and polyfilament. Now what is the meaning? Have a look. This is monofilament. What do you mean by monofilament? Can you see? There is single strand of fibers. And since there is single strand of fibers, you can see this is smooth. There are advantages and disadvantages. Since it's smooth, what happens? Risk of infection is lesser. But since it is smooth, it has a strong memory, and because of that, what will happen? The knots are not very stable. And that's why we are going to take how many knots in proline, which is monofilament suture? Usually 6 to 8. Now, what do you mean by polyfilament? Can you see? Suppose multiple strands are braided together. You can see. In this case, when the multiple strands are braided together, there is space between individual filament, and that is known as crevices. In those crevices, what will happen? Bacteria can lodge, and that's why there is increased risk of infection. Now you can easily see this is a polyfilament suture. It's something like this. So polyfilament suture is having, what can you see? There are multiple strands, and because of these multiple strands, there are spaces in between known as crevices. Bacteria can lodge into these crevices. Advantage: the knots are very stable. In these cases, the knots are very stable. So that's why what? Knots are stable. But disadvantage is there is increased risk of infection. So have a look of differences between monofilament and polyfilament sutures. Based on number of strands, sutures are divided into two types: monofilament and polyfilament. In monofilament, there is single strand of fiber. That's why it's smooth and strong. Chances of bacterial contamination is less, but it is having strong memory, and because of this strong memory, knots are less stable, more prone to slip. Knots are less stable, more prone to slip. That's why a question is asked that whenever we are using proline, especially for rectus sheath, how many knots should be taken? Usually 6 to 8. What are the examples of monofilament sutures? Examples are proline, ethylon, and nylon. You can see here again the mnemonic is PEN, proline, ethylon, nylon. In cases of polyfilament sutures, multiple strands are braided together. Advantage: it's easier to handle. Easier to handle. The knots are not able to slip. But the disadvantage: increased risk of infection because bacteria can lodge in the crevices. That's why in cases of infection, we are going to avoid polyfilament sutures. What are the examples of polyfilament sutures? Mnemonic is slip. So how to remember? Mnemonic is slip. Silk, linen, polyglycolic acid. polyglycolic acid. And you know what is the other name of polyglycolic acid? It's known as Dexan. So these are the two types of sutures based on the number of strands, monofilament and polyfilament sutures. Now one by one we will discuss individual sutures which are frequently asked in exam. First of all, catgut. So you can see that this is catgut. Now question is asked, catgut is not the catgut. Be careful, catgut is not the catgut, it is prepared from sheep gut. So 2-3 questions which are asked, who discovered catgut? It was discovered by John Hunter. It is prepared from submucosa of sheep's ileum. We use one preservative for packaging of catgut. This is frequently asked. Preservative used for packaging of catgut is isopropyl alcohol because it's natural absorbable sutures. After that, it loses 50% of its tensile strength. 50% of its tensile strength is lost in 3 days. And all tensile strength is lost in 15 days. Question is asked, 50% of tensile strength is lost in 3 days and all tensile strength is lost in 15 days. But be careful, it's absorbed in 60 days. It's absorbed in 60 days. So catgut is absorbed. It's absorbed in 60 days. This question is frequently asked. So this is catgut. Now have a look of chromic catgut. In this case, catgut suture is tanned with chromium salts. Catgut is tanned with chromium salts. And that's why it's known as chromic catgut. Why? Just to improve the handling and prevent the degradation or resist the degradation. So to improve handling of suture and resist degradation in tissues. Resist degradation in tissues. Here, tensile strength is lost in this case, tensile strength is lost in 21 to 28 days. 21 to 28 days, but it is absorbed in 60 to 90 days. It is absorbed in 60 to 90 days. These are the questions. After that, frequently asked suture in exam is Vicryl. So third is Vicryl. Now you can see this suture. This is polyfilament. What is the color of this suture? It is violet. So this is Vicryl. What is the other name of Vicryl? It's also known as polyglactin. It's the copolymer of glycolide plus lactide. It's the copolymer of glycolide plus lactide. And you must be knowing that general surgeons are using this suture excessively. That's why it's known as what? Workhorse suture of general surgeons. So it's known as workhorse suture for general surgeons. It maintains its tensile strength. Tensile strength is maintained for 28 to 30 days. So it maintains its tensile strength in 28 to 30 days, for 28 to 30 days, and it's absorbed in 60 to 90 days. So it's absorbed in 60 to 90 days. So in which surgeries we are using Vicryl? See, it's very important. Any organ in which there is increased risk of stone formation. Any organ in which there is increased risk of stone formation, in that organ we will be using absorbable sutures, not the non-absorbable sutures. So what are the organs where you can see stone formation? CBD, ureter, bladder. In all these three organs we have to use what? Vicryl. So Vicryl is used for CBD, ureter, and bladder. And this question is indirectly asked that for CBD, ureter, and bladder, we use absorbable suture or non-absorbable suture. And the answer is absorbable suture. And which one? Vicryl, which is a delayed absorbable suture. So this is Vicryl. After that, monocryl. What's the other name of monocryl? It's also known as polyglycaprone. Polyglycaprone. It's the copolymer of glycolide plus caprolactone. This question was asked in a latest exam. This is the most commonly used suture for subcuticular suturing. It's most commonly used for subcuticular suturing. And another question which is asked, in how many days it's absorbed? It's absorbed in 90 to 20 days. Absorbed in 90 to 120 days. This is the question which is asked. It is absorbed in 90 to 120 days. Next, polyglycolic acid, that is also known as Dexan. Polyglycolic acid, that is also known as Dexan. What's the problem? It's associated with polyglycolic acid or Dexan. It's the polymer of, it's written, it's the polymer of polyglycolic acid. It exhibit highest affinity, exhibit highest affinity for adherence to two important organisms, E. coli and Staph aureus. E. coli and Staph aureus. So it exhibit highest affinity for adherence to E. coli and Staph aureus. Next is, question is asked, in how many days it is absorbed? It is absorbed in 60 to 90 days. Next important is polydioxanone. Polydioxanone. Other name of this suture is PDS. And see, Dexan is having highest affinity. exhibit highest affinity for adherence to E. coli and Staph aureus. Polydioxanone exhibit lowest affinity for adherence to E. coli and Staph aureus. So this suture is having lowest affinity for adherence to E. coli and Staph aureus. And the question is asked, in how many days it's absorbed? It's absorbed in 180 days. So this suture is absorbed in 180 days. Depending upon the number of days, lots of questions are asked that which suture is absorbed in how many days. So questions are asked that which suture is absorbed in how many days. Can you see? In 60 days, catgut. In 60 to 90 days, Vicryl, chromic catgut, and Dixon. In 90 to 120 days, polyglycaprone, which is also known as monocryl. Polyglycaprone, also known as monocryl, and 180 days, PDS, which is also known as polydioxanone. PDS, which is also known as polydioxanone. So these are the questions which are frequently asked, that which suture is absorbed in how many days.